Good morning, everybody. Welcome again to another Zoom webinar, a COVID-19 training session of the National Institute for Occupational Health, the NIOH. We are a division of the National Health Laboratory Services and a sister division of the National Institute for Communicable Diseases. Greetings, can I just check if everybody has sound? And just type yes in your chat box. Not the Q&A, your chat box. If you can hear the sound. Can people hear the sound? There you are. Right. I've also did the check. Thanks. So welcome again. We've done the sound check. Just a very quick early reminder. You will see that at the bottom of your screen, so at the bottom of the screen here, you will see the Q&A box. That one there, the two bubbles, right? Please, that's where you type all your questions. Nothing else goes into that box. No comments, no requests, and so on, right? Requests to the people that must not ask you. This chat box next to it there is the one where you are going to make any other comments, ask any other administrative questions. Okay. So that's just early on. I see some people already starting to type. Thank you for the sound check. My name is Ashraf Redford. I'm the National Occupational Health and Safety Training Manager for the NIH. And today I am pleased to bring you another session, a session that deals with the available COVID-19 occupational health and safety information resources that's available from a number of different sources. And I'm going to just remind you that this is a partnership between. Sounds not good. Okay, apologies, we're just doing a technical adjustment. I understand that the sound needs to be adjusted. I'm just going to ask my colleague to just assist with that and do a quick sound check. Okay, so you're using our microphone and camera, and it's quickly going through a few seconds sequence to do a readjustment. So this session deals with the available COVID-19 occupational health and safety information resources, and we are going to rely on our colleagues from the information services section to assist us with this particular session. And I will introduce you to them in a moment. Okay. So thank you for your patience for that, just adjusting the sound and readjusting the camera. So it's with great pleasure that I welcome you to the session. The NHLS I've mentioned is our mother body, of which the NIOH is a division. This is a series of seminars and webinars online on various occupational health and safety topics specifically related to COVID-19 as an occupational hazard and a disease. So this session is probably the 40th one. I've stopped counting. I must double check on the number. So the available COVID-19 OHS information resources session is a very useful and important session. In a way, it combines and consolidates all the resources that we've shared with you over the many weeks and months in the COVID-19 webinars that we've undertaken. We are going to answer two questions today. What are some of the most important and relevant and obviously reliable sources of information that you need to know about, and where to find the sort of sources of information? So we want you to take note of where the resources are found. We will share links with you. And after the session, we are going to update a PDF resource and referral list with these links, which is clickable, and you can click on those links to find the resources. So we're not giving you an extensive, comprehensive list today.
We're giving you examples and samples, and then the PDF we'll send out to you with the clickable links will have the comprehensive list. Right, so we've made great strides in terms of running these webinars, and I must again announce that our website is 0 rated by the major service providers, mobile service providers, including internet service providers. When you go to our website, which my colleagues will refer to later, you will not be charged data. It's only the YouTube videos where you might go to that might be something that could involve data, but we're working on trying to get capacity on our website to also have that larger files. So we're extremely grateful and very privileged to have received funding from the Health and Welfare Sector, and we will have a representative, Mr. Sagi Pillay, from the Wits Health Consortium that we've partnered for this webinar, some of these webinars, to have a word and to give an introduction. So I thank you for joining, and I thank the entire NIH and Wits Health Consortium teams involved in organizing for all these sessions. I trust you have a productive session. There's an enormous amount of work that happens in order to have the sessions happen. So I'm going to hand over quickly to Mr. Segi Pillay, the Chief Operating Officer of the Wits Health Consortium, in partnership with the NIH that is having these webinars. Segi, are you online?
Yes, I am, Ashraf. Thank you very much.
Yes, please proceed. I'm not sure if Glenn if Segi is ready for video connection. Please proceed, Segi, you may.
Yeah, I am. Thank you very much. Ashraf, good morning. And again, thank you for facilitating this session. Colleagues, our participants, good morning to all of you and welcome to this session. I'm sure some of you may have participated in previous sessions, so you got a good feel for the nature of these programs. I just wanted to say one or two things, and it's important to sort of acknowledge that these webinars are only possible through the funding that was made available by the Health and Welfare Sector. And I must say, between the National Institute for Occupational Health and the Wits Health Consortium, at very short notice, the Health and Welfare Sector responded to the request to run these training programs and made funding available to develop the content, to deliver the programs, and more importantly, for those individuals who don't have access to data and or didn't have environments where you could use free Wi-Fi, etc. They made available some funding for data as well. So, you know, large numbers of you participate and have data downloaded into your system, into your devices, due to the funding that was made by the Health and Welfare Sector. So I want to record our appreciation for that, for contributing to this very important initiative. We all have a collective responsibility to ensure that as workers start returning back to their workplaces, that, and by now over 8 million people would have returned back to their regular jobs, that we have a work environment that's safe for workers, that's safe for the patients that come to the health facilities and to the social development facilities and to other places, that the contractors and are equally safe, and any visitors that come through. Because if, you know, one is that we want to manage the spread of the virus, but also it has implications in terms of, you know, potential shutting down of businesses again, etc. And that's the last thing we want to do, because there's a balance between trying to respond to the health and safety needs of all South Africans, but we also have to ensure that the economy is kept going, because we need that money to actually fund the very programs that we're running at the moment. So I hope that you will get value out of these programs. The intention is not just information sharing. It's really for shop stewards, for health and safety officers, for management, for employers, to all work together. We have a collective responsibility to ensure that we play our respective roles and protect each other by ensuring that management does what it's supposed to do, that labor understands what are the kind of guidelines and what should happen and what should not happen. Management themselves hopefully will get some skills here so that they can implement these safety measures and put in all those protections that are required. And so, I think as the program develops and as you get more and more information, comprehensively, we should be able to flatten this curve and learn, and basically learn to live with the virus, because I think that's going to be a reality until we get a vaccine available. So I thank you all for participating in the program, and I hope that you'll get significant value out of this. Again, our appreciation to the National Institute for Occupational Health, a very credible, reputable Pan-African and global organization, and they come with decades of experience in this particular field. And our appreciation to the Health and Welfare CETA for their contribution. Thank you, colleagues. Ashraf, thank you very much, and good luck with the program.
Thank you very much, Segi, for that introduction. Much appreciated. And that was the representative from the Wits Health Consortium. We are in partnership with the Wits Health Consortium with the funding support from the Health and Welfare CETA. So let me introduce you to the program and our presenters. I'm just going to have to rely on my laptop here for a moment. So our target audience, as we've indicated, are, as Segi mentioned, the employers and management, the representatives of the employer, supervision, etc. People who play a key role in terms of the Occupational Health and Safety Act in ensuring that the Act is implemented within the workplace. We also look at the occupational health professionals, occupational health and safety practitioners, and the professional bodies they belong to is critical. And then there's the employee health and wellness practitioners, the trade union representatives, the health and safety or SHE representatives, regulators, policymakers, and the labor inspectors. So we're starting off with the first topic, or rather it's actually the only topic we have, comprehensive. And this topic is what useful occupational health and safety information resources are available, so what, for COVID-19 workplace preparedness, and then the where question, where do we find these resources? So I'm going to introduce in a moment my colleague, Angel Mzanele. She's the head of the Information Services section at the National Institute for Occupational Health, that is both dealing with the our newsletter called OccuZone, our website, and 3 libraries, as well as an internal research repository, if I've got that right. Angel can always correct me. I'm pleased to be in the section that Angel manages with colleagues of mine. Another colleague is Babalwa Jekwa, also within the Information Services section. Can you hear me? Okay. So Babalwa is our medical scientist within the Information Service section. And when you send an email to info@nih.ac.za, Babalwa was the first person to then categorize and direct your request for support information resources to the relevant internal specialists and sections. So our topic again, what useful occupational health and safety information resources are available for COVID-19 workplace preparedness and prevention, and where do we go to find these resources? I'm pleased to invite my colleague and manager, Angel Mzanele. I'm going to ask Glenn just to prepare the slide presentation before Angel joins us here at the presentation table. So this presentation is going to give you details categorizing the key topics that we've dealt with over the few months, and it's going to use that set of topics as a framework in order to tell you where you can find resources and, for example, the types of resources. So are these resources our own website and what's on the website, or the other very important reliable websites like the World Health Organization, and what are the resources you find in terms of the guidelines, posters, etc., etc. So Glenn, are you ready for us for the presentation? Thank you. So I welcome Angel Mzanele. Angel, welcome to this webinar and to lead us around the key resources available for our attendees. And today, again, we've reached over 1,000 attendees. Welcome, Angel.
Thank you very much, Ashraf. Good morning, everyone. My name is Angel Mzoneli, as Ashraf has introduced us. And today I'll be looking at, together with my colleagues, available COVID-19 occupational health and safety information resources. But mostly, where do we find these resources? Ashraf has given a brief background about who we are in terms of the Institute. But I just want to give you a background so that you know how it links to what we are talking about today. So the National Institute for Occupational Health sorry about that. We're just getting our slides ready. Is a public health institute which has provided occupational and environmental health and safety support for more than 60 years across all sectors of the economy to improve, promote workers' health and safety. So we achieve this by providing occupational medicine, hygiene, advisory, statutory pathology, and laboratory services. And we do this by conducting research and providing teaching, training, and dissemination of information, which is what we're going to be focusing on today. So the NIOH has been mandated to provide COVID-19 workplace preparedness and prevention training for South African employees, OEHS professionals, and occupational health and safety practitioners. As my colleague Ashraf has said before, we have conducted COVID-19 training webinars since March 2020, and we've covered a broad list of topics, and I'm just going to mention a few, and I know some of you have attended these webinars and most of you have found them very valuable. So we've looked at the introduction right at the very start of our webinars, introduction of SARS-CoV-2 as an occupational hazard. We've looked at risk assessments. We've looked at control measures. We've also looked at return to work post-lockdown and the management of COVID-19 positive cases in the workplace. Yesterday, we looked at what to do when a COVID-19 positive case has been identified at a workplace. So the types of COVID-19 workplace information resources that are in place, that are available both internally here at NIOH, locally or rather nationally as well as internationally. We have legislations, we have regulations which are, are narrowed down documents, guidelines, we have SOPs and tools. We also have webinar presentations, all the webinar presentations that we've presented in our past webinars, which are published on our website. We have fact sheets that we have developed. We have internal ones, we have external ones, we have posters, frequently asked questions, infographics, the video and audio recordings of our webinars, and obviously the webinars that we bring to you almost every week. So importantly, there's a range of very useful resources for public health and workplace specific needs that have been shared by the NIOH presenters through the webinars, as well as resources that have been published on our website over the past 4 months relating to COVID-19. And on the list, there are some of the resources that we got from international and South African resources. As you can see, WHO, which most of what we are doing, we're guided by what WHO has put in place and other big organizations. We also have South African resources, for example, the Coronavirus Resource Portal, which will give you national legislation and guidelines. We have the national government departments, for example, your Department of Health and Department of Employment and Labor. There's lots of COVID-19 related information resources that you can find there. And of course, our resource at the National Institute for Occupational Health, focusing on workplaces. And as Ashraf has said earlier, we are a division of the NHLS. And we also have very valuable and useful resources that you will find from the National Institute for Communicable Disease, which is our sister organization focusing on infectious diseases. It's also, NICD, as we all know, is also a division of NHLS. And there's many more. So, but for today, we're gonna focus on a selected few, but that will not be an exhaustive list. There's a lot more. So what I need to remind people that as we deal with COVID-19, especially in the workplace, of critical importance is that we need to rely heavily on resources that are reliable, that are up to date, and that are credible information resources regarding COVID-19. And resources that will be able to access with ease. And I would like to also caution you that there's lots of information out there, but we need to be careful not to make decisions based on unreliable sources or what we term fake news or fake information, because that could be dangerous. We can end up putting things in place based on wrong information. So I thought I should make a point that we need to be cautious when we're looking for information that is out there, because there's a lot of it. So as I said earlier, we're going to look at three categories, or rather two categories. We're going to look at South African resources, and we're also going to look at international resources. And in terms of South African resources, we're going to start home. So we're going to start with our own resource, which is the NIH website, which contains COVID-19 workplace information resources. We will also look at the NICD website, which contains information about COVID-19 in general. So this is not specific to workplaces, but there is quite a number of information resources that you can find that are specific to workplaces. We also have regulations and guidelines that we get from the COVID-19 South African Research Portal. I've just listed just a few that my colleagues will also focus on: your Disaster Management Act and your guidance on vulnerable employees and workplace accommodation in relation to COVID-19. I'm not going to spend too much time on those ones, as I would like my colleagues will look at these ones later on. We have the COVID-19 Direction on Health and Safety in the Workplace. We've got fact sheets and infographics on coronavirus, and we've got, documents, very useful documents from our Department of Health on cloth face masks and so on. So I'm going to talk about our website, which is the NIH website, where you can find COVID-19 workplace information resources. As I mentioned earlier, the website contains occupational health and safety resources, information resources, which cover the following COVID-19 information. We've got the NIH occupational health and safety resources that you'll find on our website. We've also published some national government departments' occupational health and safety resources. We have published workplace posters and fact sheets which have been developed in-house. We've addressed many frequently asked questions which are published on our website and updated regularly. And we've also published COVID-19 training presentations and videos. So all the presentations and videos, including audio recordings of the webinars that we've had since March 2020, are published on our website, and as well as the infographics. As I mentioned earlier, there are other useful occupational health and safety information resources and external occupational health and safety links available, which we link out to from the NIH website. Then I think at this point I'm going to need to just 1 second for me. So this is just a picture of what our landing page looks like. I've just showing you a screenshot of what you will see immediately when you go onto our website. And this will show you icons and links to some of the NIH resources that we have. And here I've shown you 2 examples, which is the COVID-19 workplace posters and fact sheets, right on the top right corner box, and the COVID-19 presentations and videos on the bottom right corner. And most people that contact us are usually looking for these, but we have more on offer that we want to take you through. At this stage, I think I'm going to go through, maybe just open our website so that you can see exactly where things are sitting.
Okay, so we are going to just quickly do a live demonstration. And if some of you might be on your cell phones and have your laptops and PCs free, you might want to follow this sequence. And it's important for you to go to www.nih.ac.za if you want to do this. If you have to stay on the webinar and not disturb your current viewing audio and video and audio feed, just watch the screen. Glenn is now opening up the website for you to display on your Zoom screen. Okay. Angel, could you take us to where you want us to see one of the resources?
Okay.
Thank you.
Thank you, Ashraf. Thanks, Glenn, for setting this up. I think Glenn is left-handed, so the mouse is on the left-hand side. Okay, so as you can see, we are on our landing page of the NIOH, and as you can see there on top, it's COVID-19 resources that I'm going to be taking you through today. As I said, we have many other resources based on the work that we do generally at NIOH. But for today, we'll be focusing on COVID-19 resources. So if you scroll down, you'll see we've got 6 blocks, which I spoke to earlier on. On the top left corner, you'll see there's NIOH Occupational Health and Safety Resources. And when you click in there, you'll see all the resources that we have updated or we have published so far.
Hi, everybody, apologies for that. We've had a technical problem. I think our sound is back now, and I'm going to ask my colleague Angel just to go back to our front page where she started with the link to the webpage listing all the national government departments' occupational and safety resources. So sound is back. Apologies for that technical glitch. I think it's either bandwidth related, but the technology is back online.
Okay.
So Angel, over to you.
Thank you, Ashraf. Again, apologies for that. So let me just go back to our landing page again. As you can see, we're COVID-19 resources. The first one that I looked at was the occupational health and safety resources, which are documents or resources that we have developed internally. We have, for example, looked at the risk assessment template for general workplaces, which we've shared with many workplaces. I think a lot of people are using this as a tool or as a template to develop or to conduct risk assessments in their specific workplaces. I think my machine is a bit slow. Just apologies, Glenn is trying to get things going. Okay. And the second block look at the national government departments, occupational health and safety resources. And these are resources from the Department of Health and the Department of Employment and Labor occupational health and safety resources. As you can see, we have quite a few that we have published on our website. And earlier, I wanted to show you the one that talks about disinfection tunnels and spray booths in the context of COVID-19. So I'm going to click and you can see there's the actual document that you can open and print out.
Just to add something, Angel, that document is critical to caution people that these tunnels are not very good and recommended control measures. So please do scrutinize that document. Thank you, Angel.
Okay, and the next block. And the next block talks to COVID-19 workplace posters and fact sheets that we have developed internally. Just going to try and open that. Okay, so as you can see, we've got posters up there, and when you scroll down, you can see the fact sheets that we have developed, which have proven to be very useful. In the interest of time, I'm not going to go through all of them, but I will open one for you to see. Let me just open one that talks about hand sanitizing or hand washing. Let's just open that one. And there's your fact sheet that talks about hand sanitizing. In the interest of time, I'm not going to open all of them, but this is to show you where to find our resources with ease. Just a struggle to go back. Okay, so next is our back to our front page where we can see all the resources that we have. We have occupational health surveillance reports, which I'm not going to open because going back to the original page tends to be problematic. We've also cut our presentations, the webinar presentation per presenter, so that it's easier for people to just focus on one presentation rather than viewing the entire audio presentation or video presentation. And most importantly, we have the COVID-19 presentations and videos, and these are presentations and videos of the webinars that we've had since March 2020. So if you go onto our website, you will see that we have up until yesterday's presentations published on our website. As you know, yesterday we had a webinar on what to do when an employee tests positive. As you can see on your left-hand side, we have the audio and the video presentation, and below you can see the presentations that were delivered by our NIH colleagues yesterday. So all these can be downloaded, or you can open and print the presentations, and you can listen to the audio and the YouTube video recording. As Ashraf mentioned earlier, our NIH website is zero rated, so there is no charge to access the resources that we have. Okay. We also have FAQs, but I'm not going to go through all that. But I just wanted to show you the most important ones. As you can see on your left-hand side, there you have your frequently asked questions and the basic information about COVID-19 up to the latest information that you'd like to know about COVID-19. You can find from the frequently asked questions, and these are derived from the questions that we have received from people through the NIH query handling service, the info box, and through our hotline. So these have been derived from the questions that we received through those two platforms. And obviously, the questions that we have received from the webinars that we have conducted. So I think at this stage, I'm going to end here, and I'm going to hand over to my colleague, Babalwa Chekwa, to take us through other South African resources where you'll be able to find COVID-19 OHS information resources. Thank you.
Thank you very much, Angel. That was the introduction to the key pages. And Glenn, if you could just get the presentation back on the screen for us. I'm going to remind you that that particular website is a very useful resource. Please visit the website and familiarize yourself from the landing page, from the landing page, the key resources that you can then access going forward. So you can then find not just, you know, the sort of guidelines and legislation and so on there, but also you will find useful posters, useful forms and tools that you can use. But please remember, if you need to have any follow-up questions you want to direct to the NIH, please use the info@nih.ac.za email address to do that. Only if you have very urgent questions that you need to be addressed urgently, like for example, there might be an employee that has shown symptoms or have been diagnosed to be COVID positive, then you use the hotline where our occupational medicine colleagues will be able to give you some clear answers. At this point, I want to now welcome my colleague, Babalwa Chekwa, and Babalwa is going to focus further on the South African resources and resources. We need to know what is available and we need to know where it is. Welcome, Babalwa.
Thank you, Ashraf. Thank you so much. Good morning, everybody. As Angel has mentioned earlier, and we cannot stress this enough, the importance here is to ensure that people are getting accurate information that is not misleading. And also, because the outbreak is evolving quite rapidly, there'll be new information today that was not there yesterday. And that's why we try by all means to ensure that as soon as we get the new and updated information, we share it and make it available so as to keep everyone abreast of the latest information and its sources. Which is why on the documents and the links that we will be sharing on the slides, you'll keep seeing that there's versions. You'll get a version 4 and a version, because the information is constantly being updated and we want to keep everyone updated with the newest information. So continuing with South African resources, it's important to look at what the National Department of Health has to offer. Now, the National Department of Health, it has a dedicated COVID-19 website that contains official information about COVID-19, including regulations and guidelines. And this website is called the Coronavirus COVID-19 South African Research Portal. The link is right there at the bottom. Now, so what you can find on that website, and this is not everything, it's just some of the things that you can find on the website, are your regulations, your directions, disaster management guidelines, disaster management act. And it's also important to know that it's important that we make use of the resources that are provided by our government, because the information that the NIH is also sharing through the webinars is information that has been adapted from the regulations and the guidelines that have been provided by our national departments. The next department that also has some useful information on their website is the National Department of Employment and Labor. Sorry. Yeah, the National Department of Employment and Labor. It is a custodian of the Occupational Health and Safety Act and the Compensation for Occupational Injuries and Diseases Act, and provides COVID-19 information resources for the workplace. And as you see on that slide, there are some of the resources, very useful resources that you can find on their website is COVID-19 Workplace Preparedness Guides, Compensation for Occupationally Acquired COVID-19, which is because I think I'm privileged to be receiving most queries that come through from our attendees and employers and employees who are concerned about compensations and stuff as to COVID-19 that has been acquired in the workplace. These are some of the documents that you want to see to give yourself, to equip the employers and employees on what to do in cases where there's an employee that has acquired COVID-19 in the workplace. And you'll also find directions for coronavirus or COVID-19. The next slide is just also a table showing some legislations pertaining to occupational health and safety in the workplace that you can find on the National Department website. One of the legislations is the Occupational Health and Safety Act, and the provision there is health and safety of persons at work and the protection of persons other than persons at work against hazards arising out or in connection with activities of persons at work. Other regulations for hazardous biological agents. An example in this case would be COVID-19. So the provision there is to ensure that the risk to hazardous biological agents or exposure to COVID-19 in the workplace is controlled and reduced. And also legislation such as the Compensation for Occupational Injuries and Diseases at Work, Diseases Act, which coronavirus is also covered under, occupational diseases in mines and works, and other legislations that you can find there as well. Very useful website. Also under South African resources, you will find other useful government COVID-19 information resources apart from the National Department of Health and the National Department of Employment and Labour, which is the South African government, where you'll find your Disaster Management Act, that is consolidated coronavirus direction on occupational health and safety measures in certain workplaces. You'll see that the document that is there, the link that you're given, is the updated document, the latest, which was published on the 1st of June 2020. Another resource is Department of Health, a document talking about the guidance on vulnerable employees and workplace accommodation in relation to COVID-19. Also, that is the latest version that is currently there, and you'll see that you will find it on the NIOH website as well. You also find guidance notes for workplaces in the event of identification of a COVID-19 positive employee, which was a quite popular question that we get on people who need to be guided on what needs to happen when there is a confirmed case of an employee testing positive for COVID-19. So you can get really good guidance there. That's a guideline on what to do when you have that case in the workplace. Also, what's nice about the government department documents is that they narrow them down to SOPs that you can take and adapt them in what you can use in your specific workplace. Like this one is a standardized operating procedure, SOP for preparedness, detection, and response to coronavirus outbreak in South Africa for the health sector. And also that is a government notice on the Compensation for Occupational Injuries and Disease Act. Again, COVID-19 is also included under the injuries that are a person should be compensated for acquiring in the workplace. So that's a very important guide that one can use. Also, you will find this document, guidance note for workplaces in the event of an identification of COVID-19 positive employee, latest document on our website, the NIOH website. And as part of now the available control measures for COVID-19 in the workplace, you want to look at guidance on routine and deep cleaning of workplaces when there is a confirmed COVID-19 positive case. that has been identified in the workplace. So here we've given you a list of websites where you can be guided on the approved disinfectants. And these are very reliable sources. You'll see that it's from, most of them are from the CDC and the WHO. So the first one there is the National Regulator for Compulsory Specifications Approved List. If you click on that, it will take you to a website where you get a long list, probably like a 95-page list of all the approved disinfectants that can be used in the workplace in the case where there needs to be disinfection that has to be done. And the next one as well is an approved list from the USA, the National Regulator for Compulsory Specifications approved list. It's a South African one, very comprehensive list as well. And we have a document from the CDC. Glenn, can you pull that first document up for me? That we can. So there, that's a nice document, and yes, that's the right one there. Guidance. That's a nice comprehensive document talking about cleaning and disinfecting public spaces, workplaces, businesses, schools. So it will give you how to develop a plan to determine what needs to be cleaned, to determine how areas will be disinfected, consider the resources and equipment needed, the implementation, and how you can maintain and revise your plan. And also that gives you a nice workflow on making your plan to clean and disinfect a workplace. So if you follow those links, you get comprehensive, very useful information on how to disinfect, clean, and sanitize your workspaces. Let's go back to the presentation. Okay, we've covered that. And also the frequency of, sorry, just go back and open the second document. The third one is the frequency of cleaning and disinfecting for items in non-healthcare workplaces. Please open the second document for me, just to quickly take them through. It also just nicely shows how workplaces can be cleaned and disinfected and not necessarily healthcare places. So it's the recommended cleaning supplementary information, and what you will find there is okay, so you get a nice table there and on what type of surfaces can be cleaned with what type of disinfectants and chemicals to make sure that the surfaces or whatever you're trying to disinfect or clean is properly done, so with the correct disinfectants. And so because of time, we won't open all the links, but you get more resources on how one can make use of what's out there to make sure that the workplaces, as a control measure, are properly cleaned, whether or not there is a confirmed or case of COVID-19 in the workplace. I think I'm done, Ashraf.
Well, thank you very much for that. That was Babawa Jekwa, the in-house medical scientist with the information services section. Thank you for your contribution to that. I'm going to complete this presentation together with my colleagues. So the next slide, I think, am I clicking this correct? Okay. That was supposed to be the break introducing me. So I'm glad you enjoyed the tea. Moving on to the sector-specific information. That cup of tea was compliments of my colleague Angel. So, so for frontline workers, I think from the start, the NIH was giving specific emphasis to this particular category of workers and who required assistance, support, guidelines, informations, and resources in order to ensure that they can prepare one for this arrival of the new biological hazard in their workplace. And then eventually, you know, when lockdown happened, post-lockdown, for those people who returned to work, who had been working at home, or people who have been isolating or been in quarantine, how we need to deal with that. Here's one resource, and this deals with the crisis response tool to protect health workers against the outbreak of COVID-19, found in an international organization, that's the International Labour Organization. So that link and all these links, clickable, will be made available to you. So for example, the cleaning, just previously Babawa dealt with cleaning resources. Angel dealt with some of the resources on our website and some of the web pages there. This cleaning resources you'll find, for example, in a presentation by a colleague of ours, Dr. Charlene Andraus. And Charlene had included some of those very practical interpretation. So the specialists at NIH would then take this global resources as well as other organizations in other countries and adapt them for our conditions based on their specialized knowledge and understanding of COVID-19 as an occupational hazard. We did a specific session on the construction sector. And before that, we did for environmental health practitioners. We did a session for cleaners and security. So these were sort of sector and occupation specific. For the construction, we're sharing a few resources with you here. And you'll see that there's, I think it's 5, the construction sector site operating procedures to protecting your workplace during COVID-19. And then workplace safety during COVID-19 in construction, other outdoor work. And you'll see it's also global resources. The coronavirus, COVID-19 tips for construction, and the link is there. Then there's the COVID-19 for workplace pack for employer in the building and construction, as well as the last one that looks at the small businesses to assist those who may not have all the sort of departments and full-time resources in the larger companies and employers. Here for just a focus on some of those international resources. You have the World Health Organization links there that looks at occupational health, a particular webpage. That's the link at number 1. At number 2, we're looking at getting your workplace ready for COVID-19, also resourced by the World Health Organization, and keeping in mind, as Babawa reminded us, that a lot of these documents are updated as the scientists and the medical experts and so on, and epidemiologists are discovering more and more about this particular disease. And clearly, as a new occupational disease within the workplace, we need to stay updated to the most latest versions of these directives, guidelines, and recommendations, and the tools that are provided by the organizations, including the National Institute for Occupational Health. The last one after the technical guidance for schools, workplace institutions at number 3. Number 4 is the rational use of PPE for coronavirus disease in 2019, or rather the 29 disease in 2020. So keeping in mind that as this pandemic globally spread across the earth, resources were in short supply at times, and therefore how PPE is used, in particular the different types of masks, etc., when they are well stocked in supply, then the guidelines are very flexible and liberal. But when the stocks are low, then there are specific guidelines that gets adjusted to say, so certain masks must be used by the high-risk frontline workers, like healthcare workers dealing with COVID-19 positive patients. And eventually, the cloth masks were also introduced, and I think there's a link going forward on that. So number 5 deals with the, am I on the right page? Yes, with the crisis response tool to protect their health workers. That might be a repetition from the ILO. Number 6 is the Center for Disease Control and Prevention. That's the North American organization in the USA that provides information and guidelines here around coronavirus disease for business and workplaces. Then there's the Canadian resource from the Canadian Centre for Occupational Health and Safety, this is the CCOSH, that have published a practical information for workplaces, and you can search there, keeping in mind that these global resources is going to give you broad guidelines, and some of the guidelines are specific for their context. You need to have the input of the occupational medical practitioners, the occupational nursing practitioners, and other occupational health professionals and occupational health safety practitioners to interpret these guidelines that you might find for your own workplace. The NIH has looked at much of this and provided national sort of framework for these guidelines. Please consider the NIH website and the related Department of Health, the national government, and the NICD and the Department of Labor's website as very key websites to visit. Our website is a huge resource that is 0 rated. The last one is there from the European Agency for Safety and Health at Work. And then the 9th one there is from the European Center for Disease. You will find quite a bit of COVID-19 resources there. And some additional resources listed under number 10 is, for example, a link to the European Commission dedicated webpage, as we mentioned earlier, the COVID-19 risk communication package for healthcare facilities, the COVID-19 outbreaks, rights, roles, and responsibilities of health workers. And I think that's a very British, UK-based document. Please check it out. But we have our specific national guidelines as well that you must be familiar with. Then there's the World Health Organization link there, the Occupational Safety and Health and Public Health Emergencies, a manual for protecting health workers and responders. We must protect our frontline workers. They are one of the most important human resources we have as a nation to ensure that we deal with the epidemic of COVID-19 within our borders, and whatever support we provide to our neighboring countries. We are part of the same region and we need to support each other. The guidance on decent work on public emergency services is the second last one there, and then we have the infection prevention and control and preparedness for COVID-19 in the healthcare settings. Again, you'll see quite a bit of focusing on health settings. So to conclude this presentation and to allow you for some Q&A, we have the contact details there. The first contact is the information section's email address that is dedicated for COVID-19. And this is info@nioh.ac.za. That's a very important email for you to use if you need to ask questions, etc. The hotline is for the more urgent information you require. When there are suspected cases of COVID-19 cases, when there might have been a visitor to your workplace, a customer, client, a service worker dealing with one of your items like photocopies and so on, and you need advice, and if there's an employee that may have been either exposed to a COVID-19 positive person or who has tested positive for COVID-19. That hotline 0800212175 is important. That is 0800212175. We have given you, I think, a very thorough orientation to the National Institute for Occupational Health website. That's the link, www.nih.ac.za. I will highly recommend that you bookmark, or I'm not sure, favorite, I think in some of the web browsers is the feature. Make sure that this is there on top of your internet browsing software, and you can easily click on them or any other key resources you need to visit. So thank you on behalf of the team here. That is Angel Zonele and Babal Wajekwa from the Information Services section of the NIH for preparing and presenting this very useful and very valuable resources that you've seen on your Zoom screen today. In just scanning the chat bubble there and the chat panel, there has been many thank yous and congratulations coming through, which I'm now officially conveying to my colleagues. So I'm going to ask Suprivi, do we have anything there? Otherwise, we'll just use the chat, the question and answer box. Okay, so colleagues, let's see if we can deal with some of the questions. Just a reminder, if any of these questions are technical, meaning that our colleagues in the occupational medicine section, the colleagues in the immunology and microbiology section, the occupational hygiene section, toxicology, and so on needs to answer, we have recruited some of them to join us as panelists. You don't see them, and we'll thank them at the end of the session. They are Dr. Mpumi Ndaba, Dr. Samantha Ayulu, and Dr. Charlene Andreas. Yes. And Dr. Odette Volmink, also from the occupational medicine section. You will notice that if you have typed your questions in the Q&A section there, your questions would have been answered and shifted out of the open section, and you would be able to see your answer. Okay, so let's see. Okay, we're not going to deal with any of the admin questions about data. We're going to ask you to please contact the Health and Wealth, the WITS Health Consortium directly. I'm going to quickly find the WITS Health Consortium email address for you, and this is at Lulamile Matriko. Okay, so I'm going to give you the email address. I think it is HWS admin. Have I got that right? One moment. I'm just scrolling here for a moment. My apologies. So I think it's HWS training at witshealth.co.za. And just to confirm that, so please direct your admin questions to that. I will confirm that for you again at the end. The next question that's there is, this is from Given Goodwill. I just want to find out regarding these webinars, do we use, okay, that's a data question again, apologies. I should scan them better. So, good morning. At last presentation, you said links to certificates. Yes, certificates, we've answered that, will be made available once all your details is accurately recorded in the registration for the Zoom session. This particular person has asked from his or her mobile smartphone, a Huawei MediaPad T5. Please add your name and surname to the chat, not this Q&A, because if you don't have your name and surname and only your cell phone details, your certificate is going to have not your name on it. Okay, I need to get some to resource questions. I have the COVID-19 waste bin on site, but I'm using the normal black refuse bag, plastic bag for disposal. Is it safe? Where do I dispose of this? I'm going to, again, with somebody with a cell phone model, Galaxy J4 Core. Please, you've got to go to our website. There is a presentation dealt with the handling of hazardous biological waste, which was done by a colleague of ours from the SHE department. I forget her name now, Sheshe. And that particular presentation, where Angel showed you where to find it, will deal with the details of the disposal of biological waste, which, for example, gloves and masks and so on would be a part of that category. At my workplace, we have red plastic bags in our bins here with a little notice that says, this is for COVID-19 medical waste to be disposed. And on a daily basis, my colleagues put that in there. Our cleaning staff have been trained how to safely handle these waste bins and the bags and how to dispose of them. please, in your workplace, you've got to ensure that these measures are properly assessed in your risk assessment, and that the staff responsible for this, both those who are wearing, for example, the masks that are disposed of at work, not the reusable, clean, wash, and iron cloth masks that's not to be used at work, and then the red bags need to be disposed of properly. There are guidelines, environmental guidelines with regard to the disposal of the medical waste. Please, we don't want to see reports that we've seen in the Eastern Cape where there appears to have been medical waste that was found on a piece of land there not properly disposed. So you'll find those resources there. We can't give you a very detailed reply to that question now. We do have our colleagues as panelists online, and if they want to indicate, if they want to add something to our answers, they are welcome to do so. I think Glenn have activated their microphones for them to do so. Dr. Ndaba, Dr. Volming, Dr. Ailu, and Dr. Shalin. Okay, so let's go to another question. I'm avoiding all the data questions, people, and the certificates questions. Attendance certificates will be made available. Having noticed that in the maternity section, social distancing is not feasible. Yes, the workers do wear N95 masks, but patients in the maternity get tired of these masks when they're in labor. They throw away the masks. And my question is how safe those employees are as frontline workers with only masks, apron for the PPE. I'm going to ask my colleagues who are panelists to just join us and open their microphones and indicate who can help answer this. To initiate an answer, your risk assessment in your healthcare facility must specifically look at the maternity section. There's not a one-size-fits-all, and that section would need its own specific focus in the risk assessment. It must consider who's working there, and it's consider who is what risks they're exposed to. For example, the nursing care workers there that deals with the pregnant moms and those who have given birth, and then assess what PPE is got to be available and how the PPE is got to be handled both for the patients as well as for the healthcare workers. The audio, just the video. Okay, so for my colleagues on the panel, Glenn has made it possible for you to unmute yourselves. Okay, so that risk assessment in your workplace will then make sure that this concern must be addressed, because as healthcare workers in the maternity ward, you need to be interviewed, your risk must be assessed, and you've got to have the appropriate control measures determined and the means for those control measures to be in place, to be made available. If it's an additional visor, full-face visor, for example, that may be necessary. And I think you can also direct this question to our email address, and that email address is going to deal with your question more directly and specifically. Okay. My colleagues on the panel can just indicate if they want to join, if they've unmuted their microphone. I'm going to another question, and it deals, you see the difficulty here is we're dealing now with the technical questions, and my colleagues are best suited to deal with this critical question. Okay, so we have Dr. Mpumi Ndaba, who's going to deal with this maternity question asked by Andy of the PSA, that's the Public Services Association. Having noticed that in the maternity section, social distancing is not feasible. Yes, the workers do wear N95 masks, but patients in the maternity get tired of these masks when they're in labor. They throw away the mask, and my question is, this is Andy's question, how safe those employees are as frontline workers with only a mask and an apron for PPE. Mpume?
Hi everyone, my name is Mpume. I noted the question that says in the maternity ward it's not feasible. It might have not occurred, but there is no workplace where it's not feasible. So when we talk about social distancing, we talk about it from different aspects. It could mean distancing of the beds and so forth. But the actual delivery, you know, maybe of the baby where there is the midwife and then the patient and the baby to be born, that is the only time, and that is considered to be a procedure. And there's a specific directive or advice on what should happen when you're conducting those high-risk procedures. But otherwise, social distancing, it's what we plan up front. It's what is part of the controls that we need to put in place. We don't go according to what existed, but it's what we can try to move into that. So that will include the issue of looking at numbers that are going to be within that facility at a time, or even opening up another room or another ward to ensure that instead of having one small labor ward, if there are 10 people delivering per day, then ensure that you avail more space to be available there, which is why other institutions had to limit admissions on other, on other conditions to ensure that conditions that cannot wait, that have to be admitted for those patients, then you ensure that you have bigger space to accommodate for those. So it is possible to have social distancing, but for the specific procedures, because if you're talking about delivering a baby, it's almost like doing a procedure where maybe, like the intubation and so forth, where yes, for that procedure, distancing is not feasible, but it's just that procedure, then you employ other mechanisms in place. Thank you.
Thank you, Mpumi. That is Dr. Mpumi Ndaba from the Occupational Medicine section. And as the Information Service section, just sharing resources with you, we thought it's wise to have a few of our specialists to answer technical questions, and thanks for that, Mpumi. Okay, we're going to try and limit the technical questions, but we have a question on temporary screening machines. So maybe Mpumi, Odette, Samantha, and so on, now that we have you available, and Charlene, Tumelo Leseba is saying, I have a problem with this temperature screening machines. I would assume it's those little digital devices. There's been people found positive with COVID-19 after being tested, while the temperature machine, in quotation marks, didn't notice the temperature at all. How do we trust them? Could we have a quick response to Melo on that one from a technical point of view? Colleagues?
Hello?
Yes, please proceed.
Yes, hi, it's Mpumi again. Thank you, Tumelo, for your question. But the machines, yes, it's equipment. It might not be 100%, accurate. However, the screening questions, what is recommended currently is that you don't only look at temperature, you look at other, symptoms as well, because there have been people who would have the condition but do not necessarily have temperature. That is why, or have a fever. That is why we talk about a set of symptoms rather than the fever is not the key diagnostic feature for the condition. So I understand, I'm not defending the thermometers, I understand, but then that is why there is a move towards including other symptoms as well over and above the temperature screening. Thank you.
So I'm going to quickly go to another Babalwa, and this is Babalwa Tsawuli, not my colleague in the Zoom room. So Babalwa was asking, who can I contact with regards to management who fail to adhere to the policies, who want the employees, health workers to sign sick leave when employees go on quarantine. My advice to you briefly is to contact the Department of Employment and Labour and ask the Department of Employment and Labour monitoring and enforcement staff, that is rather IES, Inspection and Enforcement Services staff, to assist you with regard to this. The centres to provide support and advice are open in your city, in your town. Please contact them. You could also probably visit their website, secure contact details, and then phone or email them. We're moving on to the next question. This is from Letlape. I'm worried about the library and archives environment that I work in, and this is so in the field of my colleagues in information services. We run 3 libraries at the NIOH, one for NICD, that's infectious diseases, communicable diseases, one for occupational health, at the NIH and one for the National Health Laboratory Services. So the question that Latlapi has, I'm worried about the library and archives environment that I work in. How can we ensure that our library materials are free from the virus? I mean, one specific book can be used by 10 patrons in one day. And that's somebody who is at the WITS libraries. I'm going to ask my colleagues in the occupational medicine section to just look at that question. It deals with the issue of how long this particular droplets can manage to be problematic and infectious on, let's say, the outside of books or on paper. Is Charlene available? Okay.
Hi, Ashraf, can you hear me?
Yes, please proceed. Thank you.
Okay, so with regards to paper, the virus can remain viable on paper for a few hours. The exact number of hours do differ from scientific study to study, although the Australian government has advised that obviously paper cannot be disinfected and it must be, and if possible, it should remain for 72 hours untouched.
Okay.
But that, of course, is impossible, 72 hours, as in this case, the documents are handled by a few people each and every day. But what I would recommend is to just disinfect, wash and disinfect your hands before and after you touch any documents.
Thank you very much, Charlene. So to those who are working as librarians and information services practitioners within our libraries and other places, please ensure that your risk assessment has addressed this concern raised by Josiame, and you reduce the number of people that use that particular book. You may need to get additional books, and you may need to do as suggested by Charlene to ensure that that book is not managed for a period. On paper, which is the inside of the book, there's one measure. On the outside, it might have a plastic covering, and you might need to be guided and have another measure. But as Charlene said, the basic containment measures, that's social distancing, masks, hand washing of hands, hand sanitizing of hands, and reducing the number of people using that particular book should all be considered. But you need a workplace-specific risk assessment and control measures for that particular activity, that task that is engaged in. So maybe that book, if it is on the reference section of your library, needs a register, and the register must indicate what time it has been returned, and if it can only be used a little bit later to reduce the number of people, and that there is monitoring of the hand sanitizing and hand washing provision as a control measure. Okay, we have about 5 minutes left for this particular session, and let me see if I can get one or two more questions in, and it's difficult to avoid the technical questions. Okay, just moving on. So how many health workers are going to reach the community? I think there's a gap on TV coverage. Well, this is difficult for us to answer. This is dealt with at a national level by the Department of Health and those sections at the NHLS and NICD and the Special National Committee that guides and advises. So with regard to the presentation to the website, and maybe I should go to this question and then deal with some of our admin towards the end of our session. The question is, if a person, hold on, let me get this right. How possible is it that the presentations on your website could also be placed on the DPSA website? And this is a central government website for the public sector departments. Now this question comes from Zumkulu Tswaku. Zumkulu, I think we are going to ask you to contact the DPSA and propose this to them. It is clear and easy to make a link from our website appear on the website of the DPSA, as well as other resources. When a person clicks on that, it will take you to our website, and then the resources will be available. I'm sure there may need to be a conversation between their IT specialists and our IT specialists at the NIH. So that's something that you may need to initiate. Okay. one last question that's technical. So to my colleagues on the panel, we have had a few positive cases at the different fire stations, whereas a hazmat team from our training academy are being used to deep clean. My question, just for clarity, should the fire station be closed for 48 hours after deep cleaning, or for 3 hours and then opened up for operations again? Charlene, are you available? Do you have a sense about timeframes with regard to post-deep cleaning?
It all depends on what type of deep cleaning this person is talking about. If it is just normal cleaning by wiping a disinfectant on all the surfaces, especially high-touch surfaces, then you don't have to wait several hours before you open the area again. But then again, some people are still relying on fogging as a measure of deep cleaning. And in that case, you would have to wait for a longer period of time before you open up the area. So it all depends on the type of deep cleaning that is used.
So if you want some more specific details, I'm going to encourage you to email us at info@nih.ac.za if you need some more specific details, but you would need to find out what risk assessment has been undertaken, what that risk assessment has recommended as control measures, and what means have been made available for those control measures to be in place, including those timeframes that you are referring to. Okay, so a reminder, if you have further questions or you want to urgently raise your question, please email info@nih.ac.za. Any other admin questions related to your certificate of attendance? A certificate of attendance will be issued if you have accurately added all your details to the registration form when you're registered. And some of you are using your smartphones, be cautioned. The Zoom registration form captures your smartphone model and make, and not your name and surname, and that poses a problem to get an accurate certificate to you. For those who have a data issue, I'm going to quickly find and ask my colleagues to find that website, the email address for administration at the Wits Health Consortium. One moment, I'll check here again. HWS training at witshealth.co.za for any questions around data. HWS training at witshealth.co.za. Okay, for those who've got very urgent questions, please contact our hotline. And the hotline, if you could just put that slide up for us again, Glenn, is 0800, I think it's 212175. So let me just go for 0800 212175. Yeah, so if you look at the bottom box there, you'll see all of the details for our hotline, and you'll see it for the email address as well as the website connections. Yeah. These presentations will now be uploaded during the course of today or tomorrow to our website, and you will be able to access this presentation in video form and in audio form there, as well as the presentation itself in a PDF format. So at this point in time, I need to quickly thank the panelists, those you don't see and hear on screen, and that is Dr. Nompumelelo Ndaba from the Occupational Medicine section. Thank you very much, Mpumi, for your contributions. Dr. Odette Valmink, Occupational Medicine, Dr. Samantha Ailu from the Medical section, and from the Toxicology section, Dr. Charlene Andreas. Thank you very much for handling all those technical questions for us on the Q&A. Both Babalwa and Angel is putting thumbs up here, saying thank you very much for your contribution. And in the background, we have Simpiwe. Simpiwe Yako handles all our archival aspects. And days like this, he stresses behind the laptop, harvesting all your questions. And then we have Glenn, our colleague from the IT section. and somebody who's not feeling too well today, and we wish him very well, and that is our colleague Tabani. Between Tabani and Glenn, they do magic like no sorcerer can do to ensure that our signal gets to you in video and audio form, and our presentations are on the screen. And then finally, my two colleagues here in the room, I want to say thank you very much. And that's to Angel Muzunele, the head of the Information Services section here at the NIH, who runs the 3 libraries, contributes to the website, the OcuZone newsletter, and many other things, including our internal repository that contains all of the research documents. For people within South Africa and within the continent who requires details, contacts our librarians, and then they indicate what articles and journals require, scientific ones. And then we have finally Babawa Jekwa, my colleague, who deals with our queries, etc., and other support work within the section as a medical scientist. Thank you very much, ladies, for your contributions. From me, Ashraf Radcliffe, the National Health and Safety Training Manager, on behalf of the team and the team at the WITS Health Consortium, we say thank you all for joining us today. We trust you can use all these resources and make a huge difference in your workplaces. You are the soldiers on the ground. This is where the tire hits the tar in your places, where prevention and workplace preparedness is absolutely essential. So thank you and good luck with the good work.